This patient has a palpable mass in her breast that she wanted removed if possible. Here we're going to put in anesthetic, and we use a lot of anesthetic, at least 10 to 15 cc's, and we're going to numb deep to the lesion and all around the anterior, medial, and lateral margins, especially when we're going to attempt to sample a lesion so well as to remove it. This is a 7-gauge device, which is perfect for a larger mass, and the sharp tip allows us to penetrate through that thick fibrous tissue very easily. So I'm just sliding in underneath the lesion, and then we'll open up the aperture, and we can see that the lesion will kind of fall into the aperture. While I'm sampling, I'm going to be watching the ultrasound monitor, and the technologist is going to be watching the sampling to make sure that we're getting a good sample with each sample acquisition. And while we're doing this, we're talking to the patient, and they're very comfortable. If at any time they feel any discomfort, we can stop immediately and even stop mid-sampling and put some more anesthetic through the back of the device just by putting a catheter in through the back of the probe. With this kind of sampling, if we remove the lesion, it's very nice for a patient. If it's a benign lesion, she doesn't have to worry about any follow-up. She doesn't feel the lesion anymore, and that generally makes people very happy. Especially with a young patient, then they don't need to see a surgeon and have a surgical scar on their breast to have it removed if it's a palpable mass. At this point, we have just a small portion of the lesion left, and we're going to direct the sampling aperture to that residual lesion. And really, these kind of biopsies rarely have any significant complication with bleeding. You stay in the lesion as much as possible. Now I'm going to turn the transducer and look cross-section. You can see the probe. We're going to come up through the cavity and through the tip of the probe, and you see there's no residual lesion, just a small cavity. So at this point I'll hit the vacuum a couple of times, make sure the cavity is cleared out and that the probe is clear, and we can put our marker in. And we'll do that by opening up the aperture, and the technologist will help with that. So we'll introduce her. The clip can go right through the introducer and right into the cavity. And then we'll turn 180 and pull back the probe. And we'll usually hold pressure for about 10 to 15 minutes.